Welcome back to Divine Inspired Care. So glad you could join us. Let's take a journey into the fascinating world of the human body, specifically the stomach. Nestled beneath the diaphragm on the left side of the upper abdomen, the stomach is an integral part of our digestive system. This organ is responsible for grinding and churning the food we eat, initiating the process of digestion. However, beneath the rhythmic, almost mechanical operations of the stomach, this life-threatening condition occurs when malignant or cancerous cells develop in the lining of the stomach. Stomach cancer, an insidious disease, often remains hidden, revealing significant symptoms only when it's too late. We have John with us today, who have experienced this firsthand. John, a 58-year-old, commenced his expedition with a nagging unease in his belly, a dull, lingering ache unresponsive to antacids, gave alarming clues of his condition. He endured nausea and vomiting food, as though his body was rejecting nourishment. This was followed by an alarming drop in weight, a physical manifestation of his internal battle. These two unique journeys, one marked by consistent discomfort and the other by sudden, violent symptoms, were as distinct as the men themselves. Their experiences, as varied as their ages, serve as our gateway to the intricate world of stomach cancer and underscore the critical need for early diagnosis. Stomach cancer, often a silent predator, typically goes unnoticed due to subtle and misleading symptoms. This deadly disease is a master of disguise, slowly creeping upon its unsuspecting victims. The initial symptoms are quite innocent: a vague stomachache, a feeling of bloating, maybe even a loss of appetite. People often dismiss these signs as minor digestive issues, maybe mild gastritis or just indigestion. As the disease progresses, these symptoms intensify, the discomfort grows, and the pain becomes more localized. The victim might start to lose weight, feel fatigued, or even have difficulty swallowing. Unfortunately, by the time these signs become pronounced, the cancer has usually advanced considerably. The pain, initially vague, now becomes more pronounced, settling in below the ribs. When cancer is near the junction of the esophagus and stomach, it impedes the passage of food, making it difficult to swallow. It also disrupts the functionality of the gastroesophageal junction, leading to a condition known as gastroesophageal reflux disease. This condition occurs due to a fault in the lower esophageal sphincter, LES, a muscle that acts as a valve between the esophagus and the stomach. This LES normally prevents food and acid from flowing back in the esophagus after it passes into the stomach. However, in this condition, the LES is compromised, causing a backflow of stomach acid into the esophagus. This is known as acid reflux, which is often characterized by a bitter or sour taste in the mouth. If the tumor blocks the exit the stomach, the food can't pass through, triggering a response of nausea and vomiting after eating. This often leads to a significant reduction in body mass, as the body is unable to retain the necessary nutrition from food. If the tumor obstructs the stomach's exit, nausea and vomiting occur post-meal, leading to significant weight loss. A unique strain of stomach cancer impacts the entire organ, drastically limiting its ability to expand. This causes an early feeling of fullness after eating, which can significantly contribute to substantial weight loss. Moreover, this cancer variant can lead to unobserved internal bleeding, culminating in a condition known as upper gastrointestinal bleeding. This is a serious issue, as persistent or severe bleeding often results in anemia, a condition that brings with it excessive fatigue. In severe cases, the blood loss can become apparent through frightening symptoms such as vomiting blood or producing black stools. The growth subtly affects overall health, leading to telltale signs only when the condition aggravates. Stomach cancer, when it breaches its confines, can spread via the peritoneum, lymphatics, or bloodstream, ushering in a host of symptoms. These cancer cells, when they move into the abdominal cavity, can trigger diffuse pain and peritonitis. Should the liver be affected, jaundice might surface, characterized by the skin's yellowing. Understanding these symptoms is critical for early detection of stomach cancer. This disease, known for its insidious nature, often presents subtle signs that can go unnoticed without vigilance and knowledge. It's crucial to educate oneself and others about these symptoms. A persistent stomachache, sudden weight loss, persistent vomiting or nausea, or difficulty swallowing. The more we understand, the better equipped we are to identify these symptoms and take timely action. Even the slightest delay can make a significant in the course of the disease. The experiences of John, who was able to beat this malignancy due to early detection, emphasize the importance of knowledge and swift action. They are a testament to the power of awareness and prompt action in the face of potential symptoms. Stomach cancer remains a formidable opponent in the realm of health, an adversary we continue to struggle to defeat. Despite advancements in medical science, it still presents a significant challenge. This form of cancer often comes silently, with symptoms that are easy to overlook, allowing it to progress undetected. It's a silent enemy growing within, unrevealed until it reaches critical stages. However, armed with knowledge and understanding of its signs, we can increase our chances of identifying it at an early stage. Recognizing these early signs holds the key to early discovery. It could be a feeling of discomfort, unexplained weight loss, or any digestive issues. Knowledge of these symptoms empowers us to fight back and possibly win the battle against this formidable opponent. The stories of John highlight the importance of this awareness. He is not merely tales of individuals who suffered, they embody a rallying cry for vigilance, awareness, and proactive healthcare. His narratives serve as reminders of the importance of early detection and the transformative power it can have on treatment outcomes. They emphasize the need for us to be proactive, not reactive, in our approach to healthcare. John's story is not just narratives of suffering, it is a call to action for awareness, vigilance, and proactive healthcare. Don't forget to like, share, and subscribe. Until next time, goodbye.